Hi, I am Amanda Bullard. I am 32 years old from Bayleton, Alabama. I currently reside in Bayleton with my husband Josh and our 11-year-old daughter Taylor. I am a nurse currently working at Bradford Health Services in Warrior. Just a little bit about me. I started out my nursing career. I graduated in 2005 from Wallace State with my associates. During my last 2 semesters of nursing school, worked in open heart step down and open heart ICU as a student nurse at Montclair. So I had a scholarship with them, and they allowed work and sort of a learning experience at the same time. So it was a great experience, but it was a really long drive from my house. So I left Montclair, and as soon as I got my license, went to Coleman Regional Medical Center in Coleman in the pediatrics on the pediatric floor. We did a lot of pediatrics, but we also did some med-surg and had a few post-op patients. So I got a good bit of experience there. I learned a lot about medication safety. I got certified in everything. I just had this desire to learn and do more. So I had my NRP, my PALS, my ACLS, of course my BLS. So I had all these things, but I wanted more. I just really wanted more. And in the meantime, my daughter Taylor was born at 30 weeks. She only weighed 2 pounds, so she was a preemie. And so I decided when she came home from the hospital that it probably wasn't the best situation for me to be working in pediatrics and have a preemie at home. So I ventured out from pediatrics to home health, and I was in home health for 2 years. So I was in pediatrics for 2 years, and then I was in home health for 2 years, and I loved home health. I learned so much invaluable nursing experience there. I learned how to be independent, how to really teach our patients and our family members how to be part of an interdisciplinary team, how to manage the care of 75 patients, because that was my caseload. You know, I talked a lot with physicians and physicians' offices. I learned all about medications, what they're for, who uses which ones. I learned a lot about true bedside nursing in the home. And so I gained literally some invaluable nursing experience that I have carried with me throughout my entire career. But it still wasn't just what I was looking for. I was still not just completely satisfied there. And a friend of mine had mentioned to me that how much she loved working at Bradford. Bradford Health Services in Warrior, Alabama is a 189-bed addiction treatment center for chemical dependency patients. It's a behavioral health care, so there's not any acute care skills or anything there. And I thought, well, that's very different. I guess I'll give it a try. So I applied, and I started out as a floor nurse. Within a few months, they asked me to be charge nurse, and the charge nurse role is really where I got to learn how to manage and control chaos. You know, you have 200 patients and 5 nurses, and you just have to learn how to, make the most of your resources, how to manage and provide appropriate and excellent care to these people, and how to teach your coworkers to do the same thing, how to control the situation, how to prioritize, delegate, really do the most important things and provide even the most important care, what they really need for these patients, and do it all in the middle of sometimes what seems like absolute chaos. So it was a great learning experience for leadership. So not only was I doing this and I was managing the unit, but I was teaching my coworkers to do the same thing. I'm not going to be there 24/7. So even as a floor nurse, I was already sort of branching into that leadership role. And so I worked in Bradford. I was started in 2009 on the floor, and in 2011 they asked me to be the interim DON, and in 2012 they asked me to be the permanent DON. And that's in that role. That's really where I really felt like that's where I was supposed to be. My entire career had led up to this point. In general, I have great people skills. I can build relationships with people, and so I'm able to do that, and people generally respect me because I'm able to lead by example. So all of my coworkers that had worked with me before didn't have any problems with me being the DON because they knew exactly how my work ethic was. They knew what I would expect of them because I hold myself to the same standard. So it was a really great experience, but I knew I needed more education. I didn't have the skills and the tools that I needed long term for that role. So I decided I would go back, finish my bachelor's, which I obtained from JSU in 2014, and finished my master's in 2016. in population health with a substance abuse specialty. So one of the things that I noticed in my leadership role, because now I hire people, I train them, I do annual education, I do monthly education, we do CPR for the entire facility. I'm the infection control nurse, the occupational health nurse. I manage all of our nurses that are in recovery. I kind of report to the board with them, so I do their monitoring at quarterly. And so it's a big role. There's 55 of my staff members. 10 of them are unit clerks, so they're non-licensed, and the rest are all nurses. So we have a big staff. It's a big role, and I absolutely love it. I write policies and procedures. I'm on task groups to help, kind of decipher what's the most appropriate action for our facility to take, what's showing an evidence-based practice. And I learned how to better do that through my master's program. And then the good thing about that is it's one of the theories that I like to utilize in my practice is the Rogers diffusion of innovations theory. It really goes well with my population because you have to introduce a new idea. Someone has to try it. It has to catch on, and that creates this change. It brings about change. So before I started school, all my nurses were like, "I don't know how you're going to do that. I don't want to do that." And then they saw me do it, and they saw me succeed. And now I have 4 going back at the same time. They wanted it. They just needed someone to give them a little push. And I think that's part of what being a really great leader is. You sort of recognize what people need and you help them develop that on their own. So just introducing that idea. The same thing, I personally believe nursing is sort of the fusion of art and science. You have to have this passion, this desire to do really good care, provide really good care, and perfect your craft. But you have to do it all backed up by evidence-based practice. So what has worked, what's been proven to work, and what can I bring to the table? And that makes a really good nurse. That makes just excellent bedside care. And it makes a nurse that's happy because she's doing he or she is doing the absolute best that they can in their field. And that's what I want out of my doctorate. I want to obtain my doctorate and really further my field. In my master's program, I implemented a preceptorship program for nursing students because addiction treatment is not really anything that anybody learns a lot about in school, but 51% of all people are affected by addiction in some manner. So every single nurse coming out of school is going to take care of one of my patients. A patient that's addicted to something. But they're not all necessarily quite equipped to take care of that patient. So we implemented this preceptorship program, and it's gotten, excellent. We've gotten excellent reviews. We have 4 schools participating, and I have 2 more coming on board in the summer semester. So, it's going really well. The students are responding well. The patients are responding well. My nurses are loving being leaders for these students. So it really has been the most amazing experience, and that's one of those things that I never would have expected to be able to bring about that change. But I want to do that on a larger scale. So I've been asked, because when I ask, or when schools come in to do our preceptorship program, or our clinical rotation, they ask me to come and speak first to their students. So I do. And speaking to all these students, I've been able to also speak at several conferences. I've spoken at a mental health conference in Montgomery. I spoke at Nurses Day at the Capitol in Montgomery. And then I spoke at a social worker conference in Orange Beach. And all that's within the past year. So, really getting out there, advancing my field, trying to spread the word. What is addiction treatment? What are we doing about it as a medical community? And that's all part of being a great nurse and a great leader too. I just want to expand on that. I already have an idea for my doctorate project. I just have to implement it. And I'm really excited about that. Like I said, I want to bring about change. I want to further our field. I want to, continue to introduce new ideas and let it take hold and bring about real change in our community and in our field of nursing. And I really hope that I get to do that at Jacksonville State when I start the doctorate program. Thank you.